6 weeks pregnant ultrasound. What you can see. First few months of pregnancy can be quite troubling for new mothers. Their body is going through several changes. At the same time, they are worried whether their pregnancy is developing normally or have some complications such as chances of miscarriage or even an ectopic pregnancy. Therefore, doctors, gynecologists recommend an early pregnancy scan, dating scan or viability scan. The scan provides reassurance in the early phase of pregnancy. Pregnancy can be seen in the scan as early as week 6 from the first day of your last period, LMP, and not the date of conception. Many things should be monitored at this early stage of fetus development. To see these changes clearly, doctors often recommend 6 weeks ultrasound. Table of content. What is an ultrasound? Why is traditional method less effective? What to expect in 6 weeks pregnant ultrasound. 6 weeks 3 days pregnant ultrasound. 6 week 5-day ultrasound. 6 week 6-day ultrasound. What is an ultrasound? Ultrasound is a painless test doctor conduct to check what is going inside mother's womb, such as the growth of the fetus. Doctors use a plastic device which emits high-frequency sound waves through your body. The devices are attached to a machine that reads and shows the pattern on a screen. Doctors see the formed image and can determine the location and development of an embryo. And if the ultrasound is done at week 6, the doctors usually use a vaginal ultrasound machine, which consists on a long wand that is inserted into the vagina. Why is traditional method less effective? In week 6, pregnancy is in its initial stages. Thus it is hard to get accurate results. That is why doctors opt for the ultrasound, as it provides valuable information to the doctor about the baby, without putting mother's body to unnecessarily stress. As we have already discussed in earliest possible signs of pregnancy, how much important is folic acid before pregnancy. How much folic acid during pregnancy gets complete guide here. What to expect in 6 weeks pregnant ultrasound. In the past, tests were conducted at week 7, however, with the latest technology now it is possible to do a detailed and accurate ultrasound at week 6. At week 6, the pregnancy is very small, but through week 6 ultrasound doctors can see the gestational sac with yolk sac forming inside in the uterus. Doctors can see and hear 6 weeks pregnant ultrasound heartbeat on scan to make sure baby is alive and growing. The doctors can see the location of pregnancy at week 6 ultrasounds. Determining the location of pregnancy at this early stage is very important, as it will help doctors determining ectopic pregnancy, where the embryo is placed outside the uterus or inside fallopian tube. The doctor can further advise you what would work in this situation. In week 6 ultrasounds, fetal pole, the shape of the embryo, can be seen. It will be developing inside your baby. The doctor will measure its size and determine whether the fetus is growing at its normal rate or not. The doctor will also check the inclination of the fetal pole, which will help the medical team determine the health of the baby. Moreover, the head and feet of the embryo is also evaluated at this stage. The ultrasound at 6 weeks pregnant also shows blood flow, which also indicates the location of pregnancy and if the mother can carry the pregnancy to the full term. And in case doctors cannot see the heartbeat, then either pregnancy is being in very early stages, the most common reason, or the baby is not alive, happen in few cases only. The biggest benefit of doing an ultrasound 6 weeks pregnant is that doctors can see its heartbeat as early as possible and provide proper consultation to the mother. This will cut down miscarriage risks at this stage up to 10%. All detail with 6 weeks pregnant ultrasound pictures. 6 weeks 3 days pregnant ultrasound. 6 week 5-day ultrasound. 6 week 6-day ultrasound. Live healthy always. Conclusion. It is possible not to hear the baby's heartbeat at this stage because sometimes the pregnancy is not 6 weeks old. Ultrasound done at week 6 not only provide valuable information about fetus growth but also help doctors determine whether the pregnancy will last full term or not. 8 weeks pregnant ultrasound is also very important to determine the growth of fetus and to check the health of pregnancy.